So now it is my pleasure to introduce the moderator for this session, the Right Reverend Cleopas Lunga. Bishop Cleopas is the Bishop of the Anglican Diocese of Matabeleland in Zimbabwe. He has been a committed advocate for malaria elimination, as well as for other health issues throughout his career. Bishop Cleopas, thank you so much for joining us. Please unmute yourself and the floor is yours. Okay, so looks like we're just waiting for Bishop Cleopas to connect. I hope everybody has enjoyed our session so far. We had a great opening plenary about strategies for malaria elimination, and then followed by our community engagement session where we had a chance to hear from several people working in the community. And now we will hopefully hear from Bishop Cleopas to hear more about the faith perspective.
Bishop Cleopas, we can see you. Can you please try to unmute yourself and speak? We cannot hear you.
Okay.
Thank you, Bishop. Go ahead.
Greetings to everyone, and thank you for this opportunity. As people of faith, we have something that we can offer our communities, and our faith is the foundation of our what we call alternative performances, where the world neglects the vulnerable. The people of faith create wide fraternal relations through daily encounters and a concern that goes beyond our immediate biological family. And our faith hinges on the concept of wholeness of life. And any community that is engulfed with a disease is a community that has not experienced the wholeness of life. And so as people of faith, we want to give an opportunity to everyone to be part of this wholeness of life. And hence our link with the and partnership with anyone who is determined to eliminate malaria. So as people of faith, I will also ask my colleagues, Bishop Patrick Chisanga of the Diocese of Masa in Zambia, and also he is also the director of the health sector there in the Zambian Catholic Church. We also have Dr. Sheikh Piri, Secretary General of the Islamic Supreme Council, and we have Miss Axiolanda, who is the project management specialist and malaria advisor for USA, but also president of the Malaria Initiative in Angola. And these three will be joined by Mrs. Emma Mazingaliwa of the Mothers Union, the Church for St. Andrew's Parish in Livingstone, and she's the chair lady there. Joined also by Mrs. Mervis Musaga, Mothers Union member, as well as clergy spouse of the Diocese of Matabeleland. And they will also be joined by Reverend Rachel Moshana, a priest in charge of the Christ Church, Christ the King Church in Namibia. So now I will give opportunity to Bishop Patrick Chisanga to give his remarks. Thank you, Bishop.
Thank you very much, Bishop, for that wonderful introduction, and greetings to everyone. It's really a great privilege and a great honor to be part of this virtual roundtable and make my contribution as a faith leader on this very crucial theme of malaria elimination. As already indicated, I'm based here in Zambia, in the northern corner, sharing long border with the Democratic Republic of Congo. And my responsibility on the national level with the health department of the Bishops' Conference has also brought me in connection with the faith leader advocacy for malaria elimination, we call it FLAME, here in Zambia. And I'm greatly privileged to be part of this solidarity of faith leaders towards the elimination of malaria. From a personal perspective, I can share that malaria is a very familiar reality with everyone. I'll say here in Zambia, I think I can safely say that every Zambian knows and has experienced malaria directly or in some indirect form. I personally have suffered from malaria. I know close family members who have suffered from malaria. I know friends, and unfortunately we have also lost many people due to malaria, and we continue to lose them, sadly enough. Perhaps malaria has become so familiar that it tends to be taken as a routine part of everyday life, despite the many devastating effects that it has on the life of people every day. And to me, it is quite worrying when the ravaging effects of malaria on our population seem to go unnoticed, while all the attention and all the resources are being channeled to other health issues whose overall impact may not even match that of malaria. It happens often that something has come up. Currently, there is the issue of COVID-19 and tends to take the whole attention even from this reality among us, namely malaria, which continue to devastate people's lives. In my ministry, I've reached out, and I do reach out to some very remote areas of my region where I minister. And I watch with a lot of sorrow and helplessness, especially women, expecting mothers who are nursing little ones, are trying to get help, especially when they are sick. And often help not coming forth, either because the health facility is very far away and not easily accessible, or when they manage to access such facilities, they don't get the medical care they might want to access because of lack of such facilities. Usually these people are suffering, and unfortunately we have lost lives due to this lack of attention to the reality of malaria. I can also mention from a personal perspective that where deaths occur, especially in rural areas, superstition and accusations of possible witchcraft come in very easily, leading to further suffering and disruption of family life and peaceful living within the villages. As a faith leader, I do understand that my ministry is not limited to the pulpit and the spiritual matters at all. But I know that our model, Jesus Christ, did preach, but he did also heal. He did feed the hungry. And we do understand that our ministry has to be whole. We reach out to the whole person and not only to the heart of the person, as Bishop Cleophas has already indicated in his introductory remarks. And as faith leaders, we cannot underestimate the influence we have on the community, and including on the advocacy for the elimination of malaria. So just to share quickly what we are doing here, for example, sensitizing the community. We believe as faith leaders, we have a crucial role to play in sensitizing the community. As an example, I was visiting about 2 years ago one very remote area, which where people are living in fishing camps, and during the Easter festivities they come together. And I remember taking along one of the medical staff, a health worker, who, before we started our prayer sessions, carried out the test for malaria parasites. I was the first one to be tested, and then the people in the village came along to be tested. And it was, just to note how many people tested positive for malaria during that particular visit. And before we started the prayers, we had some sensitization input regarding malaria and prevention of malaria, plus distribution of mosquito nets to our people. Of
Bishop,
course,
I'll cut you short there. Thank you very much. We are behind time, and I should have indicated how many minutes are supposed to give you, but you have done so very well, and I want to appreciate your sharing. We shall be coming back later when it comes to questions, and so sorry for interrupting you, but we need to move on now to watch a video, and after that there will be other speakers as well. So sorry to interrupt you there, but that was excellent. Thank you so much.
Understood. Thank you. Okay.
Dr. Shaban Piri. I'm the Secretary General of Islamic Supreme Council of Zambia. Islamic Supreme Council of Zambia is the Muslims' national mother body, representing all Muslims in the country. Being an imam at the same time, as a religious leader in the Muslim community, it is a mandate on our community to help, and assist the community regarding, or in any manner possible, to eliminate or to encourage them to understand the problem that will face the community. A good example is that the religion of Islam is the one which gives us the mandate, because when we are talking about a disease such like malaria, it's a common problem that affects all faiths, all nations, all the communities. And as the community, as Islam provides that saving a life of a person, of one single person, is just like saving the lives of the entire humanity. And that's what Islam says. And also we believe that the Quran teaches us that if God does not give us the disease, except that He brings the cure. So this being the text of the religion, we use this kind of information, among other informations, to integrate the messages of malaria, to encourage the community to test, to sleep under the under the nets, and so on, because the religion so teaches so. Prevention is better than cure. We say in Arabic, al-waqaya khayrun min al-ilaj, and prevention is better than cure. So we go out to give this kind of information to our community through the mosques and through the gatherings. And when we do that, we don't really take it as if it is something outside the teachings of Islam, but we take it that it is within the framework of the religious teachings. And then the community begins to receive the information wholeheartedly, believing that it is part of the teaching of the religion. So indeed, as the religious leader, we engage our society, we engage our community, and to sensitize them on the dangers of malaria and how they should get involved into it. And that also includes in terms of resource mobilization, that we need also them to participate, to cooperate in this. Because there's also a scripture in Islam which says that you must help one another in matters of good. So in so doing, one is doing actually a religious duty if he is able to assist another person. So once the community gets involved in helping the society, in helping the others, definitely will be able to eradicate or eliminate this particular malaria through the involvement of everyone. Yeah, so that's the greatest, responsibility that we undertake as a community and as a religious leader within the Muslim community, is to help out the others. Thank you.
Great. Thank you for that video clip where we were listening to the Sheikh Shaban, who is representing the Islamic religion. And now we move on to hear remarks from Axolanda Cravata.
Okay, thank you, Reverend. Thank you. So we would like to start by thanking this opportunity to showcase PMI's work in Angola with faith-based organizations. Just a quick overview. PMI in Angola started in 2006, so Angola was one of the first countries. And right after the next year, 2007, PMI, together with the Angolan Anglican Church, started a project, a community-based project, sized at $1.5 million for 5 years. So it was around 300,000 for each year. And it focused in one of the municipalities, the regions that PMI supports in Angola, because we support the high endemicity areas in Angola that are based in the north and east region. So Uíge is one of those provinces in the north region. And it supported the project implemented by the Anglican Church, and benefited around 18,000 families, which was focusing on malaria prevention for children under 5, and also in malaria in pregnancy. And that counted with the community agents being trained by the NMCP, which is the Malaria National Control Program staff. And those community activists would again roll out the capacity to community mobilizers. They were based in that specific municipality in the Uíge province called Mukaba. And we saw the impact on increasing adherence for IPTP in ANC, which is antenatal care consultations, and also use and access to mosquito nets. And the project was implemented until 2012. And even so, after it was closed, Mukaba in Uíge municipality is still one of our model municipalities, because you can still see that the uptake of malaria preventive medicines for pregnant women, and also the use and access of mosquito nets, and also how they manage and understand the measures to prevent malaria is at high levels. And some of those community activists from the Anglican Church in Uíge are now the community health workers, which we call ADECOs, in not only in Uíge, but in other provinces at the North region. Currently, PMI is reactivating this kind of partnership with the faith-based organizations in Angola. They have been participating in webinar facilitated by both Rollback Malaria, Twin Malaria Partnership, and also our Breakthrough to Action. And we continue to support them with tools like social behavior change and communication tools so that they can still during masses, and also community activities led by the Catholic Church, Anglican Church, and some other Protestant churches. They can use those tools that are designed by PMI in sensitizing their communities and surround at least their faith followers. And in Angola, currently PEPFAR, given the experience from PMI, is the one working closely with these organizations. But because PMI is reactivating the partnership with these faith-based organizations, we still leveraging at both HIV and malaria, and also immunization activities. So we have seen that participation with the reverends, Protestants, and also Catholic leaders is very high, and at high levels of engagement. And it has also facilitated our community-based approaches. And the idea is to take and replicate all the best practices that have been implemented in the south region of the country, which is also where JC Flowers has operations running, and also expand to other regions of the country, the east and the north, and where PMI is currently working, and try to see if those best practices could be replicated in those areas. And those would essentially include home-based visits to do indoor residual spraying, not necessarily one of the PMI focuses, but we understand that if we communicate and sensitize the community on the importance of indoor residual spraying, it would also improve the prevention of malaria, but more essentially on the correct use of mosquito nets, going to antenatal care consultations, taking the preventive malaria medicines for pregnant women, and also making sure that every children in an occasion of fever goes to the nearest health facility. And this is what have been conducted in the South regions by Reverend Matias Cativa, Reverend João Nkanga, and also the Catholic catechist named Armando Ndala. So the idea is now to replicate all the best practices from the past, and also what has been done in the South region, and strengthen the engagement with these faith organizations that are well represented in the country, especially in the areas where PMI is now operating in Angola. Yeah.
Great. Thank you very much. Ms. Kravata, thank you so much for your contribution. And now we will watch a video clip from the members of the Mothers Union from Zambia, Zimbabwe, and Angola.
I am Reverend Rachel Moshana, a priest in charge of Christ the King Anglican Church in Namibia.
Yeah, my name is Emma Mazingaliwa. Professionally, I'm a retired nurse and a midwife. I joined the Mothers Union when I was working in Botswana. So I came to Zambia, I think 4 years ago, and I joined the St. Andrew's Anglican Church here in Livingstone. And currently, I'm the chair lady for the Mothers Union.
I'm Mavis Msaka, married to Father Jeffrey Msaka. I've got one son who is 6 years old. I am a member of the Mothers Union. I'm also a clergy spouse. I'm studying my honors degree in development studies. Mothers Union is a faith-based organization. Consists of the Anglican mothers and who are guided by the 5 objectives, which believes in the holistic approach to human needs, that is to say physical, social, spiritual, because we spread our faith in all facets of life. And if you look at our communities, women are the majority, and they are the ones who take care of our children, who are able to diagnose some of the malaria illness to their children. And they are the ones who in fact, who protect our families. So women should be involved.
The vision at least is to see that the community is well sensitized with the preventive measures of malaria. We hope to see a malaria-free zone like here where we are. That is, I think, our mission. The things that we do, mainly it's the singing. Our songs, they mainly talk about how we should prevent malaria. And also in the songs, we also talk about how the people should live, like, the surroundings, they should clear the surroundings and make sure that the mosquito nets are used properly.
As a faith leader, on every Sunday, we take about 5 to 10 minutes to teach people about malaria. Since this is a season, a rainy season, we are having too many mosquitoes. So we teach our children and our community people to keep their environment clean. We prepare people, not only spiritually, but physically also, to take care of themselves, to take care of their health, because one cannot serve the Lord. If you are sick, you cannot serve the Lord. So you need to be healed. For you to be healed, you need to take care of your health. You need to drink your medication. You need to follow the doctor description. You need to keep your environment clean. You need to learn more, to visit a clinic facility for more information. You take pamphlets, you read for yourself and also for your children.
Like when we, the trips that were planned, we were very, very much welcome because we already used to find them already seated and were waiting for us. Well, the people there, they will respond very well. And I think because usually with the health team, it's not for the health team to go to the people, but it's the people to go to the clinic. So as for us, they welcomed us because we were able to go there at their homes. And some of them, we even had to go into their homes to see how they are putting their mosquito nets, whether they are putting the mosquito nets properly on the places where they sleep.
The church is highly respected in our communities, and they trust the church most as compared to other people. So the what is being said by the church is taken as an important thing.
Well, the church is important because a lot of people, like most people here are Christians, and when you go there as a church, the people they do believe in us, and whatever we are telling them, that like when we tell them about the malaria, the prevention, and all the talk that we used to give to them, I think it made them feel more at home. When we went there, we were also being tested for malaria, just like all the other villages.
We lead by an example. So what we preach to them is also what we try to do at our houses. We give them example. We set an example.
well, being a nurse, like I said, with my background, I like to go out there in the community and talk to the people and see how people, react to when you talk to them about the malaria and how to prevent malaria. Sharing my information with the community, it has really improved my spiritual life because I'm able to interact and I'll hear also their views.
What pushed me is I'm also one of the beneficiary of this program. I had the experiences on malaria. So when I got the basic information from the Mothers Union and through training from the malaria team, it pushed me to go back to my community and help them. If we come together as a whole nation or everyone get involved, I think we can eliminate malaria.
So we need to teach one another. We need to give information out. So he create us to move, to teach, to tell people on how you should save our lives.
Definitely Jesus will care about malaria because malaria is affecting some of the activities, because when someone is suffering from malaria, it affects the economic development of that particular community. So definitely Jesus will care about it. He will not let it for the government alone. He would assist those people because those people are in need. In the Bible, there are a lot of stories where Jesus helped the sick, the lame, where he was healing those people who are in need.
So let's join hands together and work on prevention of malaria.
We do what you can, where you are, with what you have. You don't need to have millions of dollars. You don't need to have a lot of experience to save lives.
This thing of malaria, it needs inclusivity. So we have to include everybody in the fight, because if we just live for the government or for the Anglican Church, then how about others?
Great. Thank you very much. I hope you all hear me. Great. Now we can see the effects of COVID-19. How I would have loved to see Bishop Patrick face to face and hear more about his ministry. You heard from Bishop Patrick that his ministry was challenged, and not only his ministry, but also his life challenged. And he had to work hard with the communities to fight malaria. Thank you very much, Bishop, for your sharing. And we also heard from Dr. Piri of the Islamic Supreme Council, a video clip. And we learned something from other religions as well. And what I liked the most there is when he said, in the Islamic religion, they believe that they should help one another on matters of good, and that saving one life is as worth as saving a community. I think that's very, very important, because it starts with one person, and then two, and then three to form a community. And if that one is not there, then number two may not be there. So the importance of coming together to fight malaria. And we also heard from Ms. Gravata, and it was, her presentation was almost like an acknowledgement of the interdenominational, but also interfaith engagement, where people of different denominations in the Christian faith come together, engage, but also they don't stop there. The cycle grows bigger to include people of other faith. And that interface between people of faith, the interfacing with the people, the science community, but also interfacing with the business community, as well as partners who are willing to participate. This is the community. We've come together as a community, interfacing in order to fight malaria. The members of the Mothers Union, as well as the priest in charge of the church in Namibia, the three of them representing 3 countries came up with a very interesting point to continue to emphasize this wholeness of life aspect. They communicate the message through music, through songs, which they sing as Mothers Union, but they also realize and recognize their role as mothers in their experiences of looking after children. Is also translate into looking after the community and participating and engaging in the activities that are there to heal the community. And thank you very much for all those for all that information and for all your sharing. I'm sure all the members appreciate. Thank you so much, Bishop Patrick. Thank you so much to Dr. Piri of the Islamic Supreme Council, and thank you to Ms. Gravata. Thank you to Emma Masingaliwa, to Mavis Musaka, and to Reverend Rachel Moshana. Thank you so much for all your contributions.